Welcome to CRJ 151. This week we're looking at Chapter 11, which discusses the pharmaceutical neuroleptics. Now, the objective of the chapter really is to delineate what is often an ambiguous line between the use of prescription drugs and that of recreational drugs, and the often substantial risk that's taken in pharmaceutical treatment. So the drugs that are grouped together here are really the pharmaceutical neuroleptic drugs that kind of take hold of the nerves or seize the nerves. And then the effects are such that they're also useful as psychiatric medication. Now, several of the drugs discussed in the chapter, even though they're pharmaceutical prescription drugs that are used by psychiatrists to treat troubled psychiatric patients, they're also distributed illegally and often used for recreational or illicit instrumental purposes. In fact, their very unauthorized use has led psychiatrists to realize that they're not as safe as they had originally believed that they were. So this has really resulted in the medical profession cutting back on their use as medication, and then they've started to turn to alternative drugs to treat their patients. In addition, some of these neuroleptics are very toxic. Too large a dose can actually kill the user. In fact, the sedative hypnotic tranquilizer continuum, which includes things such as Valium, and then the antidepressants, those types of drugs rank among the top 5 drugs in Don's medical examiner program. That is, they frequently cause users to die of an overdose. Now, they do have considerable healing power, so they do continue to be used for authorized purposes. Now, what are these drugs and why are they used to treat psychiatric patients, and what are their appeals as well as their dangers when they're used recreationally or for illicit instrumental purposes? And that's one of the things the chapter discusses. In addition, the chapter is going to try to make clear that this group of drugs, pharmaceuticals, and the sale of those drugs constitutes a $300 billion business. And the top 200 drugs in sales fill approximately 2/3 of 1 trillion prescriptions a year. So it's a big business, and it's hard to get much changed in that. Now, although roughly 80% of pharmaceutical drugs are not psychoactive, in other words, they work more or less exclusively as a body drug, many of the mind prescription drugs, they do escape or find their way into the street and are used then for unauthorized, non-medical, and non-psychiatric purposes. And that's why we include them in this discussion. So next week we'll take a look at Chapter 12, which talks about controlling drug use.